President Biden campaigned in New Hampshire Monday, as Nancy told us, highlighting his 2025 budget proposal and calling on Congress to take specific action to lower health care costs. His proposal includes extending Medicare's annual cap on out-of-pocket drug costs and increasing how many drugs Medicare can negotiate lower prices with from 20 to 50 drugs per year. It would also close a Medicare tax loophole and increase taxes on wealthy Americans to help pay for these Medicare expansions. His budget proposal highlights major areas of debate in the election. Trump tried to repeal the Affordable Care Act, but failed, and he's promised to again, but has offered no specifics and seems unlikely to. Monday, Trump suggested the federal deficit could be reduced by cutting entitlement programs, but his campaign clarified he just meant waste, which experts say amounts to very little to address the deficit. Dan Diamond joins me now. He's a national health reporter for The Washington Post. It's good to see you, Dan. Let's just start at the beginning of this campaign. Give us some of the biggest questions and uncertainties surrounding Medicare and then health care coverage overall that the next president will face and that voters should keep in their heads as they evaluate these two candidates.
John, it's great to see you. The idea of drug price reform, this is something that both Donald Trump, Joe Biden have campaigned on, tried to accomplish. President Biden actually has passed major reforms to how the government pays for drugs. You mentioned expanding what Medicare can do when it comes to negotiating the prices of drugs. That's something that Donald Trump did not do and would not necessarily do. There's a goal of also capping things like insulin costs for Americans, potentially other areas of high need. That's something that Donald Trump tried to do but could not get across the finish line. So that's one area of difference. You also mentioned the Affordable Care Act, John. President Trump, Republicans campaigned for a decade on the idea that they would do away with Obamacare. And that message worked. They captured the House, they captured the Senate, they captured the White House, and then they couldn't do it. President Biden, on the other hand, has built on the Affordable Care Act. There are more than 21 million Americans now covered through that program. That is the most ever through the Affordable Care Act. So a couple points of difference on health coverage.
So there's often talk, and former President Trump's done it again, talking about repealing the Affordable Care Act. It was always troubling, hard to pin down the replacement vehicle for if it had been repealed. Is there a viable alternative out there? Even if Donald Trump isn't talking about it, is there a Republican alternative, or have they changed and they don't talk about alternatives so much to the Affordable Care Act the way they used to?
John, you and your viewers might recall the failure in 2017 of Republicans to put forward a viable plan that would pass Congress. Rand Paul, the senator, he led reporters at one point on a treasure hunt through the Capitol, trying to find the secret plan that he didn't even know about. So 6 years later, 7 years later, still no definite plan. I think Republicans have come around to the idea that the ACA is here to stay. But President Trump has floated this idea, which the Biden campaign is more than happy to jump on, that he might repeal the ACA or at least try to again. That message did not work for Republicans 6 years ago. The Biden campaign would love to have that fight going into 2024.
Last question, Dan. No piece of legislation is perfect. So what in the Affordable Care Act, if it's here to stay, what needs to be fixed? What areas should candidates be pressed on, Joe Biden in particular, about how to improve the program as it stands?
You know, I was talking to Brian Blais and Theo Merkel, two former Trump health officials, who said they're worried that the Affordable Care Act is now too easy, too subsidized for people to just get health plans that the federal government is paying for. They want to see more constraint over how much Americans are paying out of pocket. Their argument, Republicans' argument, is that this was not supposed to be a free entitlement program. It was supposed to help Americans buy private health insurance, not be subsidized.
Dan Diamond from The Washington Post. Thank you so much, Dan. We're going to be calling on you again. Thanks.
Thank you, John.